Different types of lead systems are available for ECG monitoring in the ICU or any other setting. Simple 3-electrode bipolar lead monitoring. Leads that can be monitored using this system are lead 1, lead 2 and lead 3. True V1 is not available in this simple 3-electrode system. This simple system is used in portable monitored defibrillators. It is useful to track heart rate, detect ROAs for synchronized DC shock, and to detect ventricular fibrillation. But it is inadequate for sophisticated arrhythmia monitoring and ST segment monitoring. 5-electrode lead system. All the 4 limb electrodes are placed on the torso and an additional electrode is placed in one of the chest lead positions. This system can record any of the 6 limb leads plus 1 precordial lead. True V1 lead is available. Lead V1 is considered the best for diagnosing RBBB and LBBB, which is useful to confirm proper right ventricular location of the electrode in temporary pacing and to distinguish ventricular tachycardia from supraventricular tachycardia with aberrancy. But V1 is insensitive for detecting acute myocardial ischemia. In this system, more than 1 precordial lead cannot be displayed at the same time. 10-electrode Mason-Likar 12-lead ECG system. 4 limb electrodes are placed on the torso and 6 chest electrodes are placed in the conventional V1 to V6 position. In this system, more than 1 chest lead can be displayed simultaneously. In the Mason-Likar 12-lead ECG system, limb lead QRS is slightly different in amplitude and axis from the conventional ECG because the electrodes are on the torso. Precordial leads also may vary slightly because of alteration in the Wilson central terminal with a change in the location of limb electrodes. Hence, there should be caution while comparing with the standard 12-lead ECG. Major advantage of Mason-Likar 12-lead ECG system. ST segment monitoring software analyzes all 12 leads and sounds alarm for ST changes even if all leads are not being displayed. Disadvantages of Mason-Likar 12-lead ECG system. 6 precordial electrodes often interfere with diagnostic procedures like echocardiograms and chest X-ray and emergency procedures like defibrillation. Precordial sites are difficult to maintain in men with hairy chests and women with large breasts. EC monitoring lead system. 12-lead ECG is derived from 5 electrodes EASI plus ground electrode using a complex formula. EC electrodes are placed on the upper and lower ends of the sternum and both sides of the chest. The derived ECG is comparable to standard 12-lead ECG for diagnosis of wide QRS tachycardias and acute myocardial ischemia. It detects ischemia missed by routine leads V1 and 2. Caution for serial comparison with standard 12-lead ECG is needed because the QRS, ST and T waves may differ between the two systems.